Hi, I'm Dr. Michelle Garvin, Director of Clinical and Sports Psychology at the University of Maryland. Maryland Athletics is excited to host Terps Talk series to provide education, increase conversation, and reduce stigma related to mental health. Today, we're here with Dr. Carlton Green to discuss the intersection of race and mental health. Dr. Green, could you please take a minute to introduce yourself?
Sure. Thank you for having me, Michelle. I'm Dr. Carlton Green. I am a licensed psychologist here in the state of Maryland. And at the University of Maryland, I serve as the Director of Diversity Training and Education in the Office of Diversity and Inclusion. And prior to being in this role, I was a staff psychologist in the Counseling Center for about 5 years.
Wonderful. Well, we're so excited to have you here with us this morning. We'll just jump right into it. The first question we have for you is thinking about the so many different identities that we have that intersect and influence our mental health and well-being. One of the things we're wondering about today is the intersection between race and mental health. And could you talk for a little bit about how these two interact with one another, and particularly how mental health outcomes may differ for minority populations?
Sure. It becomes really important for us to think about race as a social construct here in the United States. We often think about it as being really biologically based, but what we know from research is that there is nothing actually biological about race. We have created these racial groupings, and there are ways across history that some people have been moved into one racial group to make that racial group more powerful or to make it larger. But what I guess the emphasis here is that we are talking about really socially constructed groups, right?
Right.
When we think about race here in America, especially when it comes to mental health, what we know is that people of color are disproportionately affected by mental health in ways that result in negative outcomes. There's a lot of research about health disparities or mental health disparities that really get us to this. And some of those pieces could really look like when you think about the rates of depression, right? So rates of depression for Black folks and for Hispanic folks are much lower than they are for white people. But yet what we know is that depression is more persistent in Black and Latino populations. We also really think about people who identify as being more than one race, so multiracial or biracial people. They have a tendency to also report higher levels of mental health illness. We also know that American or Native Americans, indigenous people, have higher rates of alcohol and substance abuse as it applies to them. And then one of the other pieces that, when we throw race into this conversation, we also know that white people generally die by suicide at higher rates than other populations, right? So there's a way that race really affects all of us in this conversation. And the health disparities literature really helps us to really understand how it is that we are being disproportionately affected according to the racial categories that we've been assigned or we assign ourselves to.
So it sounds like it really is a pretty complex interaction. It's not something that we can just look at and say this one population is impacted in this way. There's a lot of different things to consider as we're talking about this.
Yeah. I think that, another way to think about what it is that you're describing when it comes to the disparities is that 1 in 5 Americans will end up being diagnosed with a mental health illness, according to the American Psychiatric Association, right? We know that white people constitute the largest group of Americans, here in the United States. But we also know, according to some statistics that came out from the American Psychiatric Association a few years ago, is that only about 19% of white people might actually be diagnosed with a mental illness, whereas about 20% of the American or the Native American population might be diagnosed with a mental illness. And we think of Native Americans certainly as not being as large society-wise as white folks are, right? So you see there even sort of like the disparities in mental health diagnosis. And then what we also know is that it's much more likely that people of color, Black, Indigenous, Latino folks, Asian folks, are less likely to actually get treatment than white folks are, right? So that's another way that the disparities play out.
Right. And I wonder if you could speak a little bit more toward that, thinking about how people of color are less likely to seek treatment or get treatment. Can you tell us a little bit about what you think might underlie that?
Yeah, I mean, there are so many pieces here, right, that factor into this. One of the things that I think is a little bit controversial to talk about sometimes is that we like to talk about race being one of the barriers, when in fact what it is that racism is one of the barriers, right? It's about the disproportionate treatment that people receive. And when I'm talking about racism, especially on our campus, I use Dr. Kamara Jones's definition, where she says that racism is a system that structures opportunity, often in favor of white people, and it also places more value on the bodies and the beliefs and the values of white people, right?
Right.
And so there are ways that we think about racism being baked into the mental health being baked into the mental health system. If you think about who are mental health providers, disproportionately, they are going to be white folks, right? If you think about the training that we receive as mental health professionals, most of what we talk about really applies to white, middle class, heterosexual, cisgender populations when we're getting trained. We don't often have real substantive conversations about treating people of color in mental health training, right? And then you have things like that are really systemic in nature. Well, let me back up and say this, right? What I really want to emphasize there is that whiteness is so predominant in our mental health training that we don't actually make room for talking about people of color, or we don't make room for talking about how whiteness and racism is actually impacting the mental health of people of color, right?
And I imagine one of the things that might lead to is, even if people of color are able to access the resources, it leads to maybe an inappropriate or incorrect fit or treatment that might not benefit them as much as it could.
Exactly, which is where I was going to go to the next part, right? So the data really bears out that more often than not, people of color leave therapy earlier than white people do. And a lot of the thinking around that is because of how racism might show up, and unintentionally for a lot of for a lot of white therapists, but it shows up nonetheless, right? What we also know is that there's a lot of systemic issues around this, right? The lack of insurance, or either people being underinsured. We know that also a few years ago, probably even some people on our own campus in the psychology department or in the psychology program have produced some research that says that white clinicians, or clinicians when they receive a call from potential clients, they are less likely to call the client back to connect with them if they perceive that the client might be black, right? Based upon either sort of like the tone of their voice or the name that they leave on the answering service for the clinician, versus they're much more likely to call back a client if they perceive that that person could be white, right? So there are ways, so like there's insurance issues, but there are also just access issues that have a lot to do with the clinicians ourselves, right?
Right.
If you think about just the lack of diversity among mental health providers, I've already kind of touched on that. You were getting into this issue of sort of like competent providers, whether or not people actually have the competence to address race or racial issues in treatment. And what we know, at least this is a part of what my research was on from my dissertation, what we know is that for a lot of people of color, race is a really significant issue in our lives, right? It is something that is personally meaningful to us. It provides us with a lot of pride. When we experience difficulties in the world, there are ways that we rely on our racial backgrounds or our racial heritage as a source of being able to get through different struggles, right? And so when you show up to therapy as your whole self, you may want to talk about race, or you may want to talk about racism. What we know is that a lot of therapists, especially white therapists, don't receive the training to be able to learn how to talk about racism without sort of like shutting down or getting really personal or getting defensive in the context of therapy. What that has led to is probably a real mistrust in health service provision, whether or not that is in medical settings or in mental health settings. People of color know that there's a possibility that they could show up somewhere and a person won't be able to talk about race well, right? And so it leads to mistrust. But what it could also feed in some ways is people being misdiagnosed in mental health settings, which has historically been a trend in mental health treatment. And then the other piece that I would just put up, right, especially as we think about Latino or Native or Asian populations, is that there could be language barriers between the therapist and the client that might impede progress or impede their ability to even form a therapeutic relationship, right? So those are a number of barriers that are certainly race related that contribute to the disparities in both access to treatment and people staying in treatment when it comes to people of color.
And it sounds like it could really be a cyclical process too, right? If the mistrust is there in the beginning and there's barriers to access, even if you access the treatment, you may not stay in treatment as long because it's not as good of a fit. A provider might not be trained to best assess your needs and serve your needs. And then that would lead to mistrust as
Mhm.
well, which then could fuel that cycle a little bit more.
Right, right. It can be a very cyclical thing.
Right.
What's really interesting about it, though, Michelle, and you probably have seen this in training as well, when you've been training other therapists. When I was at the counseling center, and I would be training interns to work with populations, and oftentimes people of color populations. What I would say to the interns is that it's your responsibility to bring up race
Right.
in treatment, right? What you may find is that the person of color sitting across from you may be a little bit skeptical about talking about race with you, right? And they may say, race isn't really an issue here that I really want to get into. What I have told them, so like when they've come to supervision and reported that, is that so now it's your job to either go back and bring it up again,
Mhm.
or to make sure that you create space in that therapy setting for the client to bring it up again, right? What I found probably in so like 80 to 90% of these interactions is that in a subsequent session, the person of color might come back in and say, last time you mentioned race, um, can we talk a little bit more about that, right? What that's really about is that there's research on this that talks about racial anxiety. Racial anxiety happens in our society for all people, whether or not you are a white person or a person of color. For people of color, when race becomes an issue in interpersonal interactions, what we fear is that we're going to be discriminated against, or we're going to be blamed for somebody else's discomfort in the conversation.
Right.
So one of the ways that we protect ourselves is to get out of the conversation, right? I don't want to really be discriminated against, or I don't want to be blamed for your discomfort as we're having the conversation. So the
Right.
person might shut the conversation down, right? What we know when it comes to white people and racial anxiety is that they, in fact, may perceive that they're going to be believed to be racist in a conversation. So that will cause a white person to back out of the conversation, not participate, right? What I suggest to folks, especially in training, especially mental health professionals, is that your job is really to make sure that you create space and that you also name your own race, and you let clients know that you are in this journey with them as they're trying to understand themselves. You are more than willing to talk about how race comes up and to be really present to the conversation in a way that you won't necessarily harm them or blame them when
Mhm.
race becomes an aspect of the conversation.
So providing that space is really,
Mhm.
really important.
And being persistent in providing the space, right? I've worked with trainees as well who have said things like, well, I brought it up that one time and they didn't really take it, or they said that it wasn't really an issue, right? So we don't really need to talk about that again, right? But what we know is that people need some comfort. Clients of color need some comfort in order to be able to, or to develop some comfort in being able to talk about it with white therapists in particular.
Well, and one of the things we're hoping kind of in having these conversations today is to be able to help people who aren't practitioners and providers maybe help support each other in their mental health as well. And it sounds like what you're talking about, providing that space, could really be relevant for all of us, right?
Mm.
As we're talking to friends and family and colleagues, what you're talking about in training for therapists could really be relevant for all of us.
Yes, I would totally agree with that. Especially I know that we're doing this as a part of the athletics promotion, right? So there are ways to think about coaches and administrators who I don't know these statistics for sure, but I would think that most coaches and administrators are white folks, right? And what we know, there was a report came out in the Washington Post, right, earlier this year or earlier last year about how Division I athletics is really supported on the backs of mostly Black and Brown students who are
Yeah.
playing at the football and basketball, which are sort of like the premier sports in the NCAA, right? So, in order for us to create spaces where these students can flourish, where they can actually grow and not only become good athletes but become good people, which again, for many people of color, that's going to be about how do I become somebody who is proud of my racial heritage, or how do I develop a healthy racial identity.
Right.
What could become really important is for white administrators and coaches to become much more comfortable with talking about their whiteness in the context of sport, right? It becomes important for us to recognize that for all of us, right? And I'm saying this right specifically for white administrators and coaches to recognize that you have a race too,
Right.
right? And that becomes a really important piece of this conversation. One of the things that happens oftentimes when we talk about race or we talk about diversity, what we will do is we'll talk about the other. We don't
Right.
necessarily talk about white people or men people or heterosexual people. We really sort of like cast that off for those people who are minoritized in our society. But what would be really important is for white people to understand whiteness and to recognize when racial anxiety becomes a part of an interaction. Because what racial anxiety will do, right, is that it will make us sort of like either harm other people, or one of the things that we know as therapists is that when people experience anxiety, one of the things that they want to do is get away from the thing that makes them anxious,
For
right?
sure.
Right. It's one of the ways that we think that we sort of like solve the issue, but it creates an actual negative feedback loop, right?
Right.
I'm anxious about having this conversation. I get out of the conversation. There's no more anxiety. So what do I learn? Don't talk about that,
Right.
right?
Well, plus by not having that conversation, it increases your anxiety for having it because you don't
Yep.
have any of the positive reward and you don't realize that the things you're fearing may not actually happen.
Right. And because in some ways, what we know, again, as therapists, is that much of anxiety is related to irrational thoughts,
Right.
right? Much of it really is. And so what we have done as a society is really allowed mostly white folks to carry irrational thoughts about race. When in fact, if we could just be more honest and tell the truth about it and sit with some of the discomfort that comes with that, we would be a much better society.
Right. All right. Well, I thank you so much for all of that information. I think that's something that is great for all of us to hear, and we can really start applying in our day-to-day life as well.
Mhm.
And thinking about that, thinking about our day-to-day life right now, we're in the midst of two pandemics right here. We're currently facing COVID-19 and the racial injustice pandemic. And thinking about this, this brings up the idea for me of racial trauma.
Mm.
And how does racial trauma, what is it, and how does it affect mental health of our communities of color?
That's a great question. I would encourage people to go to hashtag racial trauma is real. It's a paper that some colleagues and I wrote about 5 or 6 years ago now. And we produced it or published it on the Boston College Institute for the Promotion, Institute for the Society of, I can't even get it out now, ISPRC is the website, where people can find that paper. Hashtag racial trauma is real, one word.
Right.
When we're talking about racial trauma, what we're talking about are the physiological and emotional consequences of people experiencing racism that is oftentimes unexpected, that is oftentimes injurious for them, and leaves us really feeling stress, right?
Right.
And when we're talking about this, right, it becomes really important to note that racism is a really important part of this, a part of this equation. We're talking about being disfavored because of your race, or being denied some type of opportunity because of your race, or being surveilled because of your race, and having that experience on a repeated basis. When we talk about trauma in mental health treatment, according to the American Psychiatric Association, what we're generally talking about is a single event or an incident that creates a traumatic response in a person. And more often than not, it's at the observation or the estimation or the assessment of the mental health provider to determine if an event was actually traumatic, right?
Right.
When we're talking about racism, though, what we know is that the American Psychiatric Association and other mental health associations don't necessarily deem racism as a stressor or as a traumatic stressor for people, right?
Mhm.
So a really important part of this is that having the understanding that people of color see racism occurring, right, all the time in the country, or in their day-to-day lives. And so when we're talking about it, we are really talking about showing up to class and hearing your professor use the N-word in a reading, right? Maybe unintentionally, they're trying to maintain fidelity to some text that they're using for the course. Or you hear, and I've heard these stories all the time, you overhear a group of students saying that you're playing the race card, or you're wanting to talk about race in class. It's just you being overly sensitive. Or you go out onto campus and you look up and you see that somebody is watching you because they think that you might be about to steal something. Or even for our athletic population, right? How they might be out on campus and people look at them and see, so like their body size or their body type, and think like, oh, you must be an athlete, which is almost like a devaluing of their academic skills for being here at the institution, right? Which is very race related.
Mhm.
And so people experience these day-to-day slights over the course of their lives, which amounts to what we call stress, right?
Right.
This race-related stress actually plays out in our bodies in ways that are really negative for our health. So over the course of time, what a person might experience actually is racial trauma, right? And what we know about that is that racial trauma has real significant effects for our day-to-day functioning. And when we're thinking about a student population or an employee population, a few things like people might not be able to focus or concentrate. It's going to, if you are replaying in your head these racist incidents that occurred, whether or not it's a big racial incident where somebody is like sort of like using the N-word towards you, or you feel racially slighted or you feel left out because of some racial dynamics that are occurring, it becomes like you will replay those over and over and over again, right? People experience physical symptoms as a result of race-related stress and trauma. People might lose their appetite. People might not sleep so well, right? That's a really, really common one. What we also know is that people's attitudes about the world can change and about themselves can change. People oftentimes, especially in the therapeutic work that I do with Black men, what I often see is a sense of shame. What is it about me that allowed these people to treat me this way? What is it about me that froze in the moment in response to these racially traumatizing incidents that I wasn't able to respond, right? People really internalize it and their view of themselves begins to change. And then also I think I may have already mentioned this, but we also see physical maladies that come about as a result of this. People can have headaches or stomach aches or back aches, right? Or cramps as a result of this. And what that's really related to is increased cortisol levels in the body. And increased cortisol levels, we know, lead to pain. When your body is not able to return to homeostasis around your stress levels, then you're probably going to experience some physical levels of pain.
Sure. And so it sounds like this accumulation of stressors and experiences related to race can really lead to a lot of negative outcomes. You mentioned lack of focus and concentration, physical symptoms, shame, and experiences of potentially guilt and shame. And all of those put together are many symptoms of things that we think about when we're thinking about not being mentally healthy. And so all of these things put together really contributes to our overall mental health.
Right. One of the things that becomes really important, and this is one of the reasons why we wrote that hashtag racial trauma is real paper, is that what we tried to do with that was include what our advisor called a toolkit for managing racial trauma, right? So if people were to go to that paper, what you would see is that we kind of outline some steps. The first one being you need to acknowledge that something is going on.
Right.
More often than not, because of the stigma associated with mental health issues, we may not talk openly about what it is that we're experiencing, but that's like the first step. When you go to a doctor, the doctor needs to acknowledge what's happening with you in order to treat you for whatever malady that you might be experiencing. The next piece that we really talk about is how it is that people need to be thinking about expressing or externalizing or really getting out of your body what is happening, right? Because one of the things that racism does is that it convinces us to be silent, and that silence actually builds up the stress. So we've got to figure out how to get that out and have a perspective where we say, actually, I'm not the sick one. It's actually the society that I'm a part of that's sick, or this person who is using this racist language was sick, or this person who was surveilling me is actually cooperating in a sick system, right? The next piece is really about how do you engage other people? How do you get into a relationship with other people who are going to help you work through or think through or manage through some of what it is that you're experiencing? It becomes important for us not to stay alone with racism because that's where the shame actually festers and becomes more powerful. Being in a relationship with other people who can help you understand more about your own racial pride or to help you really discern that this wasn't really about you really can be liberating, such that people can then marshal the actual psychological resources that they have as a way of being able to move towards better health for themselves, right? And then the last piece that we talk about that is really empowerment through resistance, how it is that you can participate in political systems or other social systems to be able to challenge racism, which can then often, for a lot of people, it feels really empowering, it feels really nurturing to be able to push back on the racist system.
Sure. Well, and so I think this will be a wonderful resource for people to kind of access at hashtag racial trauma is real. They can not only hear from you, but go and read for themselves this toolkit and get a little bit of better understanding. We also on our website, Terps Talk, is we're going to have an additional resource put together by the Big Ten Mental Health and Wellness Cabinet. It's a webinar on the impact of racial trauma and mental health. So if people are interested in this, please check out our website, and we'll have both of these resources listed there. So thank you so much, Dr. Green, for your time today. I wonder if there's anything else that you feel like you really want to mention today or make sure that our viewers understand and hear about.
Sure. Maybe there's just one other resource as I think about this, or two other resources that I would talk about really openly for people. One of them is a book that written by Dr. Janet E. Helms, which is called, actually, let me pull it off my shelf here so that I can remember. It's called A Race is a Nice Thing to Have, or A Guide to Understanding White Persons or Understanding the White Persons in Your Life. Right? This is a really important tool for being able to understand whiteness and how it can function, and really giving people the opportunity to do some of that self-reflection to build up some tolerance for some of that racial anxiety, right? The other reference that I would really offer to people would be Resmaa Menakem's My Grandmother's Hands. It's a book about racialized trauma and the pathway to mending our hearts and bodies. It's a really good book when it comes to understanding the history of racialized trauma in the society. And what Resmaa does here is that he also offers tons of meditative mindfulness experiences for people to be able to slow down and really get into the trauma of the body around race.
Okay. Those sound like great resources. Thank you so much. And we'll add those to the website as well so people can check them out.
Sure. Thank you.
Well, thank you so much for being with us today, Dr. Green. We really appreciate your time and everything that you've shared with us.
Thank you for having me. I really appreciate it.